So, a lot of questions this morning. The NHS facing fresh questions over its policy on single-sex spaces in hospitals. Not just hospitals, of course, there's an even broader question than that. After this landmark ruling, which ruled yesterday, less than 24 hours ago, which ruled the term woman can only be used legally if a woman is born a woman, if she is biologically a woman.
Well, the reality star Ella Morgan has shared with Good Morning Britain one of the biggest fears she has as a trans woman.
We were in the middle of filming and I was admitted into hospital for a problem, and I was so scared that they would know who I am, not being beheaded, and that they would put me in a male ward, and I was put on a female ward, but I had my own room purely because there wasn't enough space for me with, you know...
But you might have been in a group. You
yes.
Might have been, yeah.
And I would go to I will still continue to use a female toilet. I still see myself as a woman and always will, whether this legislation comes in and people agree with it or not.
The Health Minister, Karen Smith, joins us now. Good morning to you. Thanks for joining us. A lot to talk about this morning. When we look at women like Ella who are speaking there about the situation and the concerns she has as a trans woman, what ward would she be put on in the NHS? Where does this leave us now?
Well, I think the judgment is very clear yesterday from the Supreme Court that that sex is biological sex in the Equality Act, and that rights are protected under that definition. The Equality Act also has the protection of gender reassignment, so people have rights under that. We'd obviously need to make sure that the guidance that comes out to all bodies in the coming weeks and months make sure that everybody is treated with dignity and respect as they go through the healthcare system and all parts of our society. It's a large judgment that we've only had just yesterday, so the full implications of that need to be carefully considered by the government and all public bodies, and obviously the equalities bodies will have already asked for guidance to make sure it is compliant with the law. Individuals for their healthcare, when people encounter the healthcare system, it's normally because there's something wrong that they need help and support for, and it's absolutely incumbent upon all providers to treat people with dignity and respect. And I think the NHS will continue to do that.
So what's your sense?
We have to talk about practicalities, don't we? And I appreciate the point that this law has only just come into effect. It's only been announced yesterday, so there's a lot of catching up to do. But it does pose fundamental questions. So someone like Ella, who we spoke to earlier, we put it to her that maybe, as you saw there, she was taken ill today with appendicitis, and she would prefer to wake up after the operation in a female ward. But she might wake up in a male ward because of this legislation. And if that was the case, would that be discriminatory?
Well, I think, let's be clear, the Equality Act has been in place since 2010. What the judgment yesterday is to clarify that sex means biological sex, and that is what Parliament intended. So the law was the same yesterday as it is today. We've had clarity from the Supreme Court because of something the Scottish Government were trying to do in Scotland, that women there have taken them to court. The NHS will be treating people according to their clinical need. Most people don't see wards in the sort of sense that, you know, I remember from my early days working in the NHS, large wards. We've had single-sex wards as part of legislation for over 20 years. That hasn't happened everywhere, actually, because of the quality of the estate and technical reasons around buildings. But most people don't see the inside of a hospital ward when they encounter the NHS. And where they do, many of those areas have single-sex rooms anyway. They are segregated for individual privacy. So that is the way that those providers that run NHS institutions and other institutions operate on a daily basis. Okay, and they just need to make sure that they are compliant with the law on definitions of sex, if they haven't been. I expect most people are, and that people like your commentator just now and other transgender people are also have their dignity and privacy respected.
So do you think there might need to be sort of compromise situations then that are worked out because of this? For example, as you say, there would be separate rooms rather than them being put in either a male ward or a female ward?
As I said, the sort of concept of large wards is one that is largely out of date, and I think your key word there is compromise. We've seen a lot of ill-informed and often quite offensive debate over recent years. I think that this ruling clarifying that the Equality Act that Parliament intended, that sex means biological sex, and that other people with other characteristics are also protected, is welcome. And I hope that compromise, working together, is absolutely the order of the day going forward.
As you say,
the NHS, our focus, and what I'm out today trying to talk about, is our commitment to make sure that people, whatever their protected characteristics are, whoever they are, gets off those waiting lists, gets treatment closer to home.
Can we come to that? I promise you we will. I know that's what you're here to talk about.
That is what the general public are interested in. The public, I think, will welcome
and I agree with you, they are, but can we conduct the interview? And we will come to that point in a moment. I just want to ask you this. We have seen, you talk about the toxic debate. We've seen really quite appalling performances put in by quite a lot of politicians over recent years in this debate about biological sex, how you determine it, and all the rest of it, including the Prime Minister, who frequently tied himself into knots. Everybody's come to terms with this judgment from yesterday. Politically, are you lot happy that now you can speak cleanly and clearly about what it is to be a woman and what it is to be a man?
Well, you refer to the Prime Minister. The Prime Minister, Keir Starmer, changed the Labour Party from 2019 election and our manifesto in 2019 to a manifesto in 2024, which is overwhelmingly endorsed by the British public, which included our commitment to single-sex spaces and also, as a part of, not my area, but another part of our plan for change, in making sure that we reduce violence against women and girls. So our commitment back in July was very clear on this area, and that is a change developed over time under Keir Starmer's leadership.
Yes, but you had awful moments, didn't you, where people like the Prime Minister got themselves into knots about whether or not a woman had a penis. I mean, it was ridiculous. You must be relieved that there's clarity now and we won't see statements, frankly, interviews on that level anymore.
I mean, I think interviews on that level, absolutely right. We need to move forward. I think the whole country is generally very supportive of individual rights. We're a very tolerant society. But we do want clarity around the law. That's what we've received yesterday. So moving forward, and as you've previously said, making sure we work together to protect all rights. And as I'm very keen on focusing in my area, making sure we reduce those waiting lists, we have a health service that is fit for the future, and that our plan for change that we committed to the British public, that was overwhelmingly endorsed, including by half the population, which are women, back in July, is one that we continue to focus on. That's what matters to the British public.
Yes, let's talk about that situation now, because I know you want to, highlight this plan. £80 million being made available by the NHS in England to help GPs work more closely with hospital specialists to get advice. So it's basically hoping that GPs will be able to deal with patients rather than send them off onto consultants, put them on waiting lists. The issue is here, isn't it, that it's already really difficult to get a GP appointment. GPs are already overworked and stretched, aren't they? This is only going to make that situation worse, isn't it?
The whole system is very pressurised. We know we've got people being treated in corridors, and we know that access to GPs is also really important. That's why it's the front and centre of our commitment for changing and fixing the foundations of the NHS. And recognising that extra administrative pressure on GPs is why we do have this £80 million fund set aside. The Chancellor made very difficult decisions back in the budget to increase the NHS budget by that £26 billion. We've been criticised for that, but this is the sort of thing that the Chancellor made decisions on to support. We're not just putting more money into the NHS, we are determined to reform how it works, so it works better for patients. So this gives support to GPs, to support their patients, that they don't just go onto a waiting list and then they don't hear for several months or even more than a year at a time. It's really stressful for people. And often what those people do is keep calling back to the GP and saying, well, doctor, I haven't heard anything. And then the GP is phoning into the hospital and trying to find out where people are. By taking these people who can be treated more locally off that waiting list, treating them in the community, having the GP with more guidance and advice to manage them closer to home, that will reduce the waiting list, and it means that people who do have to be on that waiting list, who might have to go into hospital, also are focused on by that specialist doctor. So it already works in many parts of the country. Yep. We want to take what works best to the rest, so that is accessible for people across the whole country.
Very quick question, so I would ask with respect for a quick answer, because we are over time now. But you are going to be paying GPs £20 for every patient that they don't refer. That looks suspiciously like a bribe.
No, it's to cover the administrative costs of referring them to something different. So they will have different treatment option than going onto the waiting list.